You're going for a jog in the park with a friend when suddenly he falls to the ground gasping for air as he goes into cardiac arrest. What do? The process of CPR is a skill that everyone should know how to do because it is a life-saving procedure and can mean the difference between life and death. To learn how to perform CPR on an individual, I will first tell you what it is, what the different types are, and how to perform it. So what is CPR? CPR stands for cardiopulmonary resuscitation. It's a life-saving technique that is issued when someone's heart stops beating or the person stops breathing. You may think that only medical personnel can do it, but really anyone can if they know what they're doing and if they are certified. CPR is so important because in the time that the paramedics are taking to get to the scene, that person could have already died. 10 minutes, that's how long it may take for a person to die from not receiving emergency care. So would you rather try to do something to help or do nothing at all? Therefore, if someone around you is having a medical emergency and may need CPR, here's what you need to look for. First, check for a pulse on the radial side of their wrist or right under the side of their jaw in the carotid artery. Then check for breathing by looking to see if the chest is rising or falling. And if the patient has no pulse and is not breathing, start CPR immediately. However, you cannot perform the same CPR on just anybody. There are 3 different types of CPR: adult, child, and infant. Adult CPR is composed of a 30-to-2 ratio of compressions and rescue breaths. So for every 30 compressions, stop and give 2 breaths and repeat. Know that all CPR is given at 100 beats per minute. When giving rescue breaths, one must use the head tilt chin lift method. After you've finished your 30 compressions, you will then place one palm on the patient's forehead while also pinching their nose and put your other hand under the chin or under the jawline and tilt the head up to open the airways. This is the most basic form of CPR and usually the most common. However, when giving CPR to a child or infant, things are slightly different. In child CPR, only one hand is required rather than 2 hands, and it uses the same 30-to-2 ratio of compressions to breaths. Also, if an AED is available, it is highly recommended. An AED is an automated emergency defibrillator. It is a machine that includes pads to deliver shocks to the body in order to restart the heart. They can be used on adults, children, and infants. Infant CPR is the last form of CPR. It requires the use of 2 fingers rather than 2 hands. It is performed at a 15-to-2 ratio of compressions to rescue breaths. So instead of giving 30 compressions and then 2 breaths, you would give 15 compressions and then 2 rescue breaths. Finally, I will tell you how to perform CPR. When assessing whether a patient needs CPR, remember the acronym CAB. CAB stands for compression, airways, and breathing. When you begin CPR, you should do it until medical personnel arrive. Starting the procedure, you should first place the patient on his or her back, then place both palms on top of each other and lock your fingers. Place your hands on the patient's chest between their nipples and use your body to push down on their chest at least 2 inches. If performing CPR on a child, place one palm on their chest in the same spot and push down 1.5 inches. For infants, you would hold out your forearm, laying the baby on top of it and gently holding their head with your hand. Then place your index and middle finger below their breastbone between the nipples and push down 1.5 inches. If performing CPR with 2 people, you should switch roles of giving compressions and breaths so you do not get too tired. Compress at 100 beats per minute and give 2 rescue breaths and repeat this procedure until the patient shows signs of movement or until the paramedics arrive. In any case, if an AED is available, turn it on and follow the directions. In conclusion, you do not have to have expert experience to try and save a life, and by following these steps and staying persistent and confident, it will be effective. When someone is in medical trouble, what you or someone else does in those couple of minutes could determine whether that person lives or dies. You just learned what CPR is, the 3 different types, and how to perform it. CPR is not required to know, but your actions in those mere moments of watching someone you know taking their very last breath could save a family member, a friend, or a stranger. As someone who is CPR certified, I hope these lessons I just showed you could help you later on in your life.